Hello everyone, welcome back to my channel. Today I would like to discuss very interesting entity, actually specific manifestations on CT. So I think one of the advantages we as radiologists have, so we see the patient and we just see the whole spectrum of different entities that my patient have besides what clinician think, because every imaging pattern they just show a specific diagnosis. So I just want to show an example. This patient was like a 40-year-old female, like presented with some sort of head trauma. So basically they were looking for bleed or like any other things that you're just going to expect for a patient from a fall. So if you just quickly look at this head CT, like in a quick look, I just don't want to spend that much time, but you see that, okay, this looks like a very good brain for a 40-year-old, right? And I don't see any abnormal intracranial hemorrhage or anything. But we just don't stop here. We have to go beyond. We have to just look at our search pattern. We have to look at everything. So let's look at the orbits for a second. So this is a 40-year-old female for the orbit. If you just focus on the orbit, you see that we see like a massive enlargement of the optic nerve sheet, CSF spaces. So if this is the optic nerve, you see that the optic nerve sheet is just like markedly prominent and enlarged. It's just a little bit like tortuosity on these optic nerve sheets. So this is one thing that is just very unexpected for a patient with 40-year-old. Okay, so far it's just pretty non-specific. I don't know what's going on, and specific is the CT, non-contrast CT. Okay, so now I start looking at this. I see the huge cellotorsical and partially empty cell appearance, and also I see enlarged Meckel's right here. Okay, let's look at other views. So if I just show you the coronal reconstruction, you see that this patient has a huge partially empty cell. So this is a very unusual appearance for a 40-year-old, and then again, if you look at the orbit, you see that the optic nerve sheet are just hugely prominent. So they are very dilated. There is prominent CSF space sheet, CSF in the optic nerve sheet. Okay, let's keep looking. Then we look at our sagittal reconstruction and see again, we're going to see these huge partially empty cell, the cellotorsical is just very deepened, as you see here, and then we have partially empty cellular appearance. If I look more closely, I see that this there is some sort of cerebellar tonsillar descent as well. So looks like there is a little bit like acquired tonsillar ectopia. So if you put all these findings together, you see that there is huge optic nerve sheet CSF spaces, there is partially empty cella, there is cerebellar tonsillar descent, and there is enlarged extraction CSF spaces, specifically Meckel's. There is only one diagnosis, which is idiopathic intracranial hypertension, or IIH. Nowadays, it's a very common diagnosis, specifically in people who are overweight or obese, and they usually present with headache, and most of the time, these patients just go underdiagnosed for many years and they suffer. So imagine that as a radiologist, you just flag this to the clinician, to the referring physician, and they just can go from there and just get a good care. The important lesson from this as radiologists, we are not just looking for the cause that the patient sent to us. We just look at the patient as a whole. So this patient just presented with like a traumatic injury. They were looking for bleed, intracranial hemorrhage, like colloidal fracture, but we just see something beyond. I think that's the beauty of radiology, and that's the art of a radiologist, that just look at everything, look at all the imaging features, and provide the actually essential diagnosis that actually change the patient's life. So I personally really enjoy this aspect of radiology, because we always can provide additional information that nobody aware, and we actually help a lot, and this is the area that we can add value. Thank you for listening to me, and if you like this video, please make sure to subscribe and follow me on this journey. You're going to see more interesting cases along the way.